what I'm going to do is share with you, not so much perhaps on what we are doing, but my experience with bringing organization towards patient safety, quality improvement, and clinical governance. Can I have the next slide, please? So in the very beginning, this was probably about 20 years ago, and I hope that my sharing will benefit the attendees, because I think all of us are at different parts of the journey for patient safety, right? Not all of us are on the same, like Taiwan and all that, that's ready to go and has a system, and your patients and your staff are all with you on a buy-in, right? So in the beginning, 20 years ago, I don't know whether this resonates with any of you, okay? You go up to a senior doctor, right? The expert in the field, the cardiac surgeon or your neurosurgeon or somebody well respected in your hospital, and you say patient safety. Next slide, please. This is the answer you're likely to get, right? They roll their eyes, look at you and say, I've been practicing for the last 20 years. I have good results. I'm the best known. Everybody comes to me. Are you telling me that I'm unsafe? Okay, so that's the end of your conversation, all right? You're thrown out of the room. Okay, so how do you bring your organization from this stage, to something that talks about patient safety and is open to patient safety initiatives, right? Is anyone on your side? Okay, I generally find that the younger people are easier to bring along, but your very senior people are their mentors and their models, right? So how do you bring them along with you? You really do need someone on your side from that group of people. How do you find that? Sometimes it's by luck. So there was one day when exactly this same response was given to me in an open audience, right? There were like 200 attendees, senior doctors. We were trying to do our first JCI and telling people about patient safety, audits, process, policy. And the doctors all say, me and my patient, okay? N is equal to 1. I'm the expert. I know what to do. Don't tell me about, policies, protocols, all right? That's irrelevant, okay? So suddenly one gentleman who is, you will be surprised, very often they are actually not head of department. They are not somebody who has, a name against their name, a bracket against their name, but they are well respected. And he suddenly stood up and he said, actually what she's talking about makes sense, right? And I support this movement. And that's how we managed to start our JCI, by bringing the senior people along. Yes, there was a lot of arguments, but at least you know that there are 1 or 2 people who are on your side, and then the younger people who respect these older people will also come along. Next slide, please. So we were a 1,500 bedded hospital, and in those days we had 6 incidents reported per year. Okay, and generally is when a patient has died, and you know that nobody can escape from this. Okay, it's a known incident, then it gets reported. And there was so little trust that reports were systematically de-identified. Okay, so for example, I had one report that was sent to me where the reporter actually bothered to go to a magazine, newspaper, and cut out letters, okay, to form a report for you, right? And even anonymous reporting was thought to be tracked. They told me, oh, it's anonymous, but you can track my IP address. Okay, I don't know how many of you know what an IP address is. I certainly did not know, but that's how much trust there was about safety and reporting. Okay, next slide, please. The next thing that we all do is we have a KPI, right? So basically, if you have a KPI, your hospital will meet that KPI. So what do I mean? Next slide, please. Right, so if you have a KPI that says serious reportable incident 0.3 per 1,000 patient days. So at the end of the year, you will get 0.29. And most institutions will say, oh, great job, great job. So this year we must do better. Okay, so let's do a KPI of 0.25. So we basically want to bring it down lower and lower every year, right? Which is a sign of doing well. But that just means that everybody will say, well, you want it to be lower, that's great. You just won't report it. Okay, so you will meet your KPI. So one of the things I did when I first took over, I said, let's, instead of having 0.3, let's put the KPI as 3 1,000 patient days. Okay, of course, the whole organization went up in arms and said, you must be crazy. You want more patients to have a serious reportable incident? So I said, well, it's not that, but I do know these incidents do happen on the ground. It's just that nobody is reporting it, right? So the other point I need to bring up is it also depends on your country. If your country has a very litigious coroner's court system, then of course people will try not to report because they really do not want to be called up to the court to answer for a case, right? So really what they're looking out for, next slide please, is a culture change, right? You need either a champion to form a culture change, or you basically need an idiot, right? So I was that idiot. Next slide, please. Right, so we started this JCI, and I started a patient safety office, a clinical governance office as well. Building trust was really crucial, right? People wanted to see, they didn't want to hear, they wanted to see what happened to other people who reported incidences, right? Do you really mean just culture, right? Or do you just say, oh, it's just culture, but when someone reports, you report them to HR and then they get a mark on their record, right? So people are truly looking at what you're doing. And to be frank, at the start, we almost had to do a no blame culture, even though I do not advocate a no blame culture. But at the start, you really have to show that we mean business. We're not out here to get anyone into trouble. We want to know what is systematically wrong and we want to improve, right? The other thing is you must have a system that closes the loop. I think all of us hate it when I go to the extent of reporting and so on and so forth. And then in the end, I find, actually nothing is done. Nobody read the report. Nothing is improved, right? Month after month, the same thing still happens, okay? So that is what people hate as well. All right, next slide. Right, so it's just a waste of time unless you can get improvement. And sometimes you do have improvement, but the person reporting it never hears about it, right? So how do you close this loop? What is your reporting system? Everybody is looking at, is management serious about hearing my voice? And the culture slowly built up over the years, and people did believe that there was true safety and a desire to improve. And soon now we get near misses, not just reports, but near misses which get reported, and it comes to thousands. And that is exactly what you want. You want people to report before someone dies, right? You don't need someone to die to learn a lesson, surely, right? We are in the improvement in the healthcare industry. Okay, next. So as we moved along and culture was built, we started exploring across institutions, right? Can we do learning across departments and institutions? And soon we had people, right, myself and a few others, who went up to the ministry level, and we encouraged sharing across hospitals. Of course, the first time we had this meeting, the press was there. And of course, ministry was very unhappy and said, see, I told you it will go to the press. But the fact is the press was actually fair. And in fact, there were good comments. People sort of said, well, the hospital is now serious about improving, and they're honest and they are looking at themselves, including the things that have gone wrong, right? Okay, next. So we were also involved in the WHO right side surgery checklist, which you will find in the WHO website. And Singapore at that time showed very good results on compliance to surgical checklists. But of course, you can be compliant, but the acid test is what is the outcome. So we continued to track our outcome. We had people in anonymous, in a sense, anonymous people who were looking at this process and quietly reporting what actually goes, on the ground, which I think is very, very important. Next. So finally, my final point is, where is the patient, okay? The final stage is whether patients get involved. What does a patient understand about patient safety? How can they contribute, and what will they do for the institution? I will give you an incident which, really was quite shocking for me at that point in time, but I realized it was a quantum leap in what is patient safety, right? So one day I had a call, okay, connected to me, through the operator, and it was a patient. And the patient said, I looked at the directory and you are listed as the patient safety officer. I want you to know that this happened to my mother. Okay, I'm not going for a legal suit. I'm not trying to sue you, but I want you to know this was what happened to my mother. And then she described an incident. And then the next thing she said is, I really don't want this to happen to someone else. And I would really like you to come back to me in a reasonable amount of time, what you think could have been done and what you think your hospital is going to do about this. That was quite shocking for me, but I realized that this is the opportunity for us to move to the next stage, which is getting patients involved. And of course, I did keep her informed at 3 months and 6 months on what we were going to do and what we have instituted in our institution. Next slide. So this is our patient advocate, right? These are patients. Of course, some of them are our staff, but many of them are our patients. They form a group called SPAN, and they chair it themselves. And they go to various areas that they are interested in as either patients, relatives, and so on and so forth. And they contribute to the process and the safety of our patients because they are the ones who really know the process very well. So for example, the chair is a lady in orange, right? Pink, okay, right in the middle. And she is a mother of one of our patients who's been in the system for, well, the patient is now 14. So 14 years she has been in the system. Okay, next. So the journey, next. Patient safety is a journey, it's not an end, right? Just when you think you have done well, the next incident will happen. Patients see incidences differently from us, right? And we all, as management, we all think that we know what we're doing, we know what happens. But very often that is not the case, okay? A lot of times people will tell you, well, because you are here, everything is going right, okay? If you're not here, actually it's not like that. And sometimes if you listen to the patients, they have a totally different perspective of what we're doing, right? So I think what is most important is what matters most to the patient. And that's where we really need to focus all our efforts on. Next. So there's always something to learn from each other. And I'm very happy that I'm here to share this and learning from all of you as well. Thank you very much.